Welcome back to Safe Step. This channel focuses on high-risk medical moments that families don't see coming, especially after injuries or hospital stays or sudden changes in mobility. Everything that we discuss here is grounded in geriatric medicine, emergency care research, rehabilitation science, and public health guidance. Today's topic might surprise you because sometimes the fall is not the real emergency. This video is for educational purposes only and does not replace medical advice. Always speak with a qualified healthcare professional about individual care decisions. Here's what many families experience. Someone falls, they get checked out, there's no broken bones, maybe a few bruises. Everyone breathes a sigh of relief. But then, days later, something changes. They seem weaker, they seem more confused, more tired. They stop walking as much. They don't seem like themselves, and suddenly they're back in the hospital. Research in geriatric medicine shows that the weeks after a fall carry significantly increased risk of hospitalization and medical decline, even when the fall seemed minor or insignificant. That's because a fall is not just a physical event. It is a whole body stress event. And today we're talking about the hidden medical complications that can develop after a fall, the ones that families don't connect until it's too late. Let's start with one of the more dangerous delayed complications. A person does not need to lose consciousness in order to have a brain injury. Even a minor bump in the head can cause small veins in the brain to tear, leading to slow bleeding. This is called subdural hematoma. In older adults, the brain shrinks slightly with age, which stretches these veins and makes them more vulnerable to tearing. Here's the dangerous part. That bleeding can be slow, and symptoms might not show for hours, days, or even weeks. Instead of dramatic signs, families may, however, notice increased sleepiness, headache, confusion, personality changes, trouble walking, new weakness on particularly one side of the body. People taking blood thinners like Warfarin, apixaban, rivaroxaban, or even daily aspirin are at higher risk. Emergency medical guidelines emphasize that any neurological change after a fall is a reason for urgent medical evaluation, not because the fall was severe, but because the brain could be bleeding silently. Now let's talk about something that most families have never even heard of. And this is hard to say, so bear with me. Rhabdomyolysis. If someone falls and remains on the floor for a long period of time, especially hours, their body weight compresses muscle tissue. And when those muscle cells are crushed, they break open and release a protein called myoglobin into the bloodstream. Too much myoglobin can overwhelm the kidneys and cause acute kidney failure. Symptoms often appear later and may include dark or tea-colored urine, severe muscle soreness, weakness, confusion, decreased urination. This is why emergency medicine considers a long lie after a fall of serious medical event, even if no bones are broken. The damage is not from the impact, it's from pressure and time. After a fall, people often move less. They may be afraid to walk to the kitchen. They may avoid getting up to use the bathroom. Pain can reduce appetite and fluid intake. Even mild dehydration can quickly cause problems in older adults. Blood pressure drops, kidneys receive less blood flow, and medications become more concentrated in the body. This can lead to dizziness, confusion, weakness, more falls, or even kidney injury. So sometimes the hospital visit days later isn't because of the fall injury. It's because the body quietly became dehydrated while activity decreased. Movement keeps blood circulating properly in the legs. When someone suddenly becomes less active after a fall, the blood flow slows. This can allow clots to form in the deep veins of the legs, and this is called deep vein thrombosis, or DVT. A clot travels to the lungs and it becomes pulmonary embolism, which can be life-threatening. Warning signs may include new leg swelling, calf pain, warmth or redness in one leg, suddenness, shortness of breath, chest pains with breathing. The fall didn't cause the clot directly, but the inactivity afterwards did. When mobility drops, breathing changes too. People take shallower breaths when they move less. They cough less forcefully. They may spend more time laying down. And this can allow mucus to build up in the lungs, creating an environment where bacteria can grow. This is why pneumonia risk increases after periods of reduced mobility. Families may notice things like increased fatigue, mild cough, low-grade fever, shortness of breath, confusion in older adults. The connection to the fall is not obvious, but sometimes the timeline is. Fall activates the body's stress response. Stress hormones rise, inflammatory chemicals circulate. Heart rate and blood pressure can fluctuate. For people with heart disease, diabetes, or frailty, this stress can destabilize existing conditions. We sometimes will see worsening heart failure symptoms, irregular heart rhythm, blood pressure instability, increased fatigue, general physical decline. Once again, the fall did not break it, but it pushed the body past its tipping point. After a fall, watch for change, not just injury. Changes in thinking, changes in walking, changes in appetite, changes in energy, changes in breathing, and bathroom habits. If someone feels different, they might be. An early medical evaluation can prevent a crisis. So here's today's safe step rule. The emergency isn't always the moment of the fall. Sometimes it's what the fall sets in motion. Watch for days after, watch for weeks after, and that's where hidden danger lives. In our next safe step video, we're going to talk about how to spot early signs of mobility decline, the subtle changes that appear before a major fall or hospitalization happens. Because prevention doesn't start in the emergency room. It starts with noticing small changes early. Take care and take the safe step.